Redivus in action. This is Marjorie's story. Marjorie, an 82-year-old nursing home patient, is yet again asking her nurse, Christy, for more blankets because she feels chilled to the bone. As Christy enters her room, Marjorie, usually sharp as a tack, has forgotten Christy's name. Concerned about her patient's change in mental status, Christy grabs a set of vital signs, pulls out her Redivus Health tool, and begins to answer a few questions. Christy continues to investigate with the Redivus tool because Marjorie has 2 out of 4 SIRS criteria as well as mental status changes. Her CNA states that Marjorie also has had a wet cough since yesterday that seems worse this morning. Christy enters her productive cough as a potential source for infection. Marjorie is now screening positive for sepsis. Her doctor needs to be notified, and the clock is ticking. Christy adds Dr. Dunn to the event and immediately contacts him via phone. Dr. Dunn and the nursing staff coordinate rapid EMS transport to the local emergency department for assessment and treatment. Greg with EMS arrives, and the patient is transferred to him. As Marjorie is loaded into the ambulance, Greg takes the blood pressure and discovers her BP is low, as well as observing the confusion reported to him by Christy. Greg enters that data into step 3 of his Redivus tool, and now Marjorie screens positive for severe sepsis, requiring a 30 ml per kg fluid bolus intervention. Greg initiates the fluid bolus and charts it in his tool. The EMS team transport Marjorie to their local ED. Greg then transfers the Redivus event to Jason, the ED-RN, as part of his report. Jason opens the web app to review the previous documentation, then deselects labs unavailable, draws labs and blood cultures. The labs are resulted showing an elevated white blood cell count and an elevated lactate. Jason inputs those values into the Redivus tool. A little while later, Jason receives a reminder notification from Redivus that he has pending interventions yet to complete for Marjorie's 3-hour bundle. Once completed, Jason sends Marjorie to the ICU for 6-hour bundle completion and further monitoring. As Marjorie's family arrives at her bedside, her blood pressure and confusion continue to improve due to the rapid recognition and intervention by her medical care team.